Good afternoon, everyone. Hope you're all doing well. Many thanks for joining us on this webinar today. For those that I haven't met yet, my name is Charmaine. I head up the training team for Ardens. And today we're going to be looking at how we can help you to enhance menopause care by using the Ardens resources. So this is mainly going to be for SystmOne practices. If you are an EMIS practice, then your webinar will be happening next Tuesday at 1 o'clock, and we will share some details on how you can register to that webinar. Now, I am really pleased to have one of my colleagues join this webinar today, Tessa, who you can see on screen.
Hi, everyone.
Tessa, hello. Tessa is one of our clinical leads, and she also works for our clinical development team, and she's also a GP, and she's also a women's health lead. So it's really, no better person to lead on this webinar today than Tessa. And Tessa will be providing a walkthrough of all of the different resources that are out there and available for you right now for you to start using. So before we launch into what that looks like, we are going to bring up just the housekeeping slide just to make sure that you're all happy with how to use the different features. So first of all, you're not connected to a camera or a microphone. You would have worked that out by now. If you do have any questions, then please use the Q&A section. Be familiar with where that is, because we want you to answer as many questions as possible. We want you to come out of this webinar feeling confident in how you use our resources. That's really important to us. Now, the session has been booked for 1 hour. It does depend on the questions that we have, but please make sure you do answer those questions, and the session will be recorded as well. So please make sure that you share it with your colleagues. We will email it out to everyone that's registered on the webinar. We will also make sure it goes on our website too. I also have another colleague who I haven't introduced yet, and I want to introduce because she'll be answering the questions in the Q&A, and that is one of our training specialists, Hannah Butler. Hannah, she covers the Southwest region for our training team, but she very much does a lot of the SystmOne training, so you may have met Hannah before. Hannah is off camera, but she'll be answering the questions in the chat as we go along. We will open up probably to some verbal questions, Tessa, at the end for anyone that wants to verbally answer their question. So if you do want to hang around until the end to be able to do that, then please do. We will make sure that we share all of the training resources that you can tap into after the webinar as well. Now, what we've been doing with these webinars recently is we've been introducing poll questions just to get an idea of who our audience is and how you're currently using our resources. So I'm going to fire a couple of poll questions now. They will come up in the middle of your screen. You just answer the question, and then we can then all see those answers. And the very first poll question that I'm just going to launch is just understanding what your primary role is. It'd be really good to know, are you a clinician? Are you not a clinician? Maybe you're not a clinician here, but you want to share that information with your clinicians back in your organization. So I'm just going to launch that now, and that will come up on your screen. And if you just click what your primary role is, submit that, and then we can then have a look at the results that come through. Okay, and there's quite a few of us on here, so I'll give you just a second to answer that question, because it'd be really good to understand who our audience is. So at the moment, Tessa, we've got 32% who are GPs, which is a good audience. And we've got 24% who are AMPs, 24% who are practice nurses, and we've got 19% who are non-clinicians. So hopefully that's targeting the staff roles that you want to in this session today. Yep. Thank you for answering that. Next question is, we just want to understand how you're currently using the resources at the moment. We're covering menopause today, like you know. We do have templates out there. We do have formularies out there. We also have a dashboard out there at the moment. So I'm just going to launch this question to see, what are you currently using now? Ignore the spelling mistake on dashboard. And you can pick more than one choice as well. Even if you're not using any of them, that's absolutely fine. No problem. It just gives us a good idea again of currently where you are. We're going to answer the same question at the end as well. Fine. So most of you are using our templates. No one is using the dashboard at the moment. That's fine. We'll show you how that works today. Thank you very much. So I'm now going to pass you over to Tessa, and I'll be speaking to you all soon.
Hi everyone, and thanks for joining the meeting today. As Charmaine mentioned, I am a GP working with Ardens, but my other job is just a regular GP as a salary GP in Somerset. And we basically took on the task of refreshing our SystmOne resources to support better menopause care across on a scale nationally. Starting off with that, we decided, okay, what is it actually going to look like in practical terms? So the first thing was just making sure that we had the ability to undertake a structured assessment, because sometimes the consultations can be a bit meandering, I guess. But what I really wanted for clinicians was sort of a comprehensive but a quick way of documenting the symptoms that women can present with. We wanted also to kind of underscore everything with shared decision making, which means that you have an informed clinician sharing their information with their patients, and that the patient is then able to make an informed decision. We wanted to also ensure that our formularies were up to date, evidence based, and really sort of push to the front safe prescribing as well for our patients, so that we don't really have anything outside of the guidance in terms of our HRT formularies. The next thing was making sure that there was a plan for planned follow-up, which is not sort of making sure that women weren't sort of told just see how you go, that they're actually called in a timely fashion for their annual reviews for HRT. And this is all underpinned by clear documentation and coding. I completely understand how this sort of stuff can slip in a busy clinic, and it's one of the things where sometimes I will say, oh, it's just faster for me to free type this. But the issue is, if we don't code it, then we can't report on it. If we don't report on it, then we can't make any changes, particularly at scale. So what I'm going to hopefully demonstrate to you today is our menopause templates and the refresh versions of these, the menopause formulary, and the women's health dashboard, which Charmaine is going to show you. So I've taken all of this because I'm a clinician. I wanted to underpin this with a clinical scenario. So we've got Sarah here, who is our 48-year-old woman. She is booked in for a routine appointment on my busy Monday morning mid-clinic. She is a mum, and she's been troubled recently by hot flushes, irregular periods, and poor sleep. So quite classic perimenopausal symptoms. She hasn't come to the GP surgery about this before, and there's no kind of past medical history that I can see in her notes that I'm particularly worried about. She thinks she's going through the menopause. She's read a little bit about it. She wonders if she needs a blood test to confirm. And she's spoken to her friends who've gotten on well with HRT, but is debating whether or not that's the right call for her because she has some concerns. So the first thing you'll find when you go to the SystmOne template is the diagnosis page. And we've built this not to sort of say you must make a diagnosis in this fashion, but really to signpost clinicians to say, actually, in the vast majority of cases, in accordance with guidance, we don't really need to do a blood test. And you can share this information with Sarah. So for a lot of patients, you might consider it. So we've put those in the amber bracket. And FSH isn't indicated when somebody's presenting with typical menopause symptoms over the age of 45 and they meet the other criteria. But in the women that you do want to really think about it is in when you have suspected premature ovarian insufficiency, because we need to diagnose those women, have them on our registers as having suspected POI, and ensure that they are properly managed. In terms of assessing symptoms, we've also built in that quick checklist so that you can go through it. You can also jump to the green score, which we've revamped as well, which will help you document either in a quick fashion because you've sent out a questionnaire with the green score on it beforehand, or if you're chatting to Sarah and you just want to make sure you've gone through the possible symptoms, this will give you that complete symptom picture. We've also got your initial consultation page. And the key thing about this is to remember it's not a you must tick everything type template. This is an aid memoir. So it's meant to help you, help remind you of what things that you can ask about. And often I will forget about, oh, I didn't check about her contraceptive needs, or I forgot to actually ask her what her periods are actually doing at the moment. Are they heavy? Are they sporadic? And it just gives you that ability to sort of reduce the cognitive load on you. So I might have the conversation with her face to face, and then I might turn to the template and say, okay, what have I just forgotten to check? You'll see as well that we've made sure that we've kept in those cardiovascular risk factors, because we understand now that these menopause consultations are a really important point, at which point we can address these potential risk factors with Sarah. So I'm just going to show you quickly, hopefully not in too clunky a way, the actual template itself on our SystmOne test system. So if you don't use the F12 button, I know lots of people don't, but it can be really useful in terms of finding templates that you feel that you're using for it very frequently. So as you use the F12 button, you'll pull up this screen and you can search for whatever template and drag it into your section. So we're going to look at this one to start with. So those are the pages that we've just covered: symptoms, initial consultation. Section here at the bottom is talking about management. So this area is really about anybody who is coming to see you about menopause or perimenopause and advice that you might want to think about HRT. So if in this case, so things like asking about genitourinary symptoms, talking about maintaining muscle mass. But here's the kind of key thing, that you've talked to Sarah about HRT and potentially non-HRT options also. If you click into HRT assessment, this is what we used to call a risk assessment page. It is still mostly a risk assessment page, but what I have tried to avoid is just making it all about risk assessment. So we want to make sure that we've also talked about osteoporosis risk, because in some women there may be a benefit in going on to HRT because they're at risk of osteoporosis. In each of these, when you click on them, you can go through with Sarah. Have they got any family history of cancer? Okay, she's got a family history of breast cancer. And this page is acting like a decision support tool. So this area here, the risk assessment, you'll either have no contraindications or cautions present, or contraindications present. In Sarah's case, she's told us that she has a family history of breast cancer. It was her mum and she was affected at age 65. So we're going to tick this box. Having gone through the rest of these things, she's also mentioned maybe she's got migraines but no aura, and we're not particularly concerned about anything else. So she's got no history of clotting risk, for example. So in Sarah's case, we've suggested, okay, there are some cautions present. I'm going to run through and decide whether we're going to start HRT and then go through each of the boxes. This box I find is quite useful because it gives you those kind of, recognises some of the nuances with HRT. So Sarah is still having periods, and typically I would want to start her on sequential HRT. But there are some scenarios where I might be thinking, actually, she might be better off because maybe she's got catamenial migraines or she's got a history of endometriosis. Maybe we'll start her on continuous combined HRT instead. But it just gives you those prompts to think about those things as well. It also allows us to document that we've asked her about whether or not she's on a GLP-1 and that we have checked if we've adjusted her progesterone appropriately. The next step then is in terms of the HRT counselling. So I'm just going to pop us back to our page. All right. So going back to HRT counselling, we've devised this page based on BMS guidance and NICE guidance. So you can see here we've got a link to the NICE discussion aid, which is that really nice, really clear guidance graph that they've given us. So you could show that and discuss that with Sarah in the consultation. We've talked about the proven benefits and the proven risks potentially with HRT. So that I find that I was having these conversations with patients, but it often takes quite a long time to document them. So I wanted a way that we could be able to document that we've had that shared decision making with Sarah. The next thing to show you is that Sarah's decided that she would like to start HRT. So in this scenario, we're going to go to our formulary page. So, sorry, showing my excellent IT skills. So you can access the formulary again from your quick launcher or from searching from the features, or it's obviously linked to from this page as well. So the new formulary looks like, hopefully it's not going to take too long to load, like this. So we listened to feedback about our old formulary and users found that the homepage was very, very busy. And what we've tried to do is make it a bit more graphical and also help as, again, like a decision support tool. So you start at the top. Does the patient have a uterus, has uterus or without uterus? And you can go through each of these options as is appropriate for Sarah. So for Sarah, we know that she has a uterus and she's still having periods. So this is the most appropriate option for her. When you pop into this box, it's asking you then to check, are there any indications where you might consider continuous HRT? So it's just alluding back to that box that we looked at before. In Sarah's case, we've not noted any indication for continuous HRT, so we're going to choose sequential. And that will lead us down to these options here. Each of these options are meant to act as a one-stop shop. What we are trying to do with the formulary is build in safety mechanisms so that patients are not inappropriately prescribed unopposed estrogen. So we can say for Sarah, she's decided she likes the sound of the gel. Again, you've got your prompts here to document that you've advised her about not taking her estrogen on its own. And again, if applicable, about using a GLP-1 or if she's on high dose estrogen. And from these boxes, you can just prescribe directly. So everything that you need to prescribe the transdermal estrogen or sequential progesterone is on this single page. We've also given some advice here linking back to the BMS guidance about alternative progestrogens, like using oral utrogestrone vaginally or other types of progestins that can be used, but just prompting the user to consider the individual's risk factors if they are applicable. Just showing you another option that might be commonly used. So Sarah, if she has a uterus but she already has a coil in situ, so you click that box, it's going to tell you exactly which option to go through. And you click on this, and again, it's just documenting that you've confirmed she's got a 52 milligram hormonal coil in situ take. You've got the link to the FSR or College of SRH guidance, and you've got your ability to prescribe your estrogen from there. So again, it's just building in that safety mechanism to avoid unopposed estrogen prescriptions. We do have options for testosterone prescribing as well as GSM prescribing, which are available again from the template. When you talk about the review, so Sarah will be called in for review by our reporting system. So our reports will, whether or not Sarah is due for a review. When you're doing the review, it's just a single page. So we listened again to feedback. Currently have an initiation and monitoring template, but I think a lot of users felt that there was just too many templates to cope with in terms of in a consultation going through to way too many templates. So we decided just to re-amalgamate the review back into this single template. So all the review can be taken care of from the single page. Again, it's just prompting you that it's a review, how many years on HRT, because you might want to think about switching them to combined depending on how long they've been on sequential, and recapping their bleeding pattern, contraception, and whether they've got side effects. The key boxes are these, so assessment of risk, that you've checked if they've got any new cautions or contraindications, and that you've also reassessed their endometrial protection. So that might be things like looking at whether they're now on high dose estrogen and they should be on a higher dose of progesterone, or at least be considered for a higher dose of progesterone, or whether they've now started a GLP-1 since you last saw them. So another clinical scenario. The next template I wanted to demonstrate to you was about unscheduled bleeding on HRT. You may be familiar with this template already because we published it last year, but it's a very, very useful template. I wanted to showcase what it can actually help you do when you're in an actual practical scenario. So I've sent Sarah off, she's on her HRT, she's relatively happy with it, but she's come back at 11 months and she's now got irregular bleeding. And I'm often faced with this scenario in practice and I think, oh, I'm not really sure what I should do. Should I refer them? Should I send them for an endometrial assessment? Should I send them on a fast track assessment? Or should I send them for a scan? And obviously, you may be aware that there was the excellent guidance from the BMS joint guideline with the RCOG about how to manage unscheduled bleeding on HRT. However, it can sometimes be hard to pull that up in the middle of a consultation. And so what we've done is we've essentially converted that into a template form. So if I can again show you our unscheduled bleeding. So again, back to here. So I'm just going to get out of this template. And I'm going to go access by F12 again, because I find that's the easiest way and the quickest way. And this is our unscheduled bleeding template. So with Sarah, because it's the first time she's presented to me, I would be looking at the consultation page. And the key thing here is you can put in that she's on HRT, so that just documents it, whether she's on unopposed or combined. And you can also put in what kind of bleeding has she been getting, no bleeding, normal bleeding, or abnormal. I don't think you'd be in here if she was getting a normal bleeding pattern. Findings, that's just what you found on your examination. And then this is the key thing, because if you're familiar with the guidance, the decision is made depending on whether or not they've got concerns, major risk factors, or minor risk factors. So we've got these easily visible here. So concerns are at the top, major risk factors and minor risk factors. So imagining in Sarah's case that she's got maybe, for example, 2 minor risk factors, I can select both of those. And then I'm going to scroll down to see which impression is the most applicable for Sarah. So here you can see she's got an absence of major risk factors. I'm not worried about any of those, but she has 2 minor risk factors. Again, acting as a decision support tool, this template is going to guide you what to do next. So HRT management, adjustments to HRT made, and the link here is to that RCOG guidance, specifically to the page which tells you how to adjust HRT. Request an ultrasound and gives you that time frame, so within 6 weeks, and follow-up arrange to review her ultrasound findings. When Sarah then comes back and she's had her ultrasound, again, this is a typical thing that I often am faced with in clinic. I might get an ultrasound report back into my inbox saying, has had her scan, please review. And I'll see that there's an endometrial thickness of 9 millimeters, for example. I often have to, sometimes you might get a bit of guidance on the actual report itself, but if you haven't gotten something specific or you're not sure, this template can guide you as to how to manage that ultrasound scan report. So the top section is pretty similar to the consultation section from before, but for this one, we're going to select the most important or the most relevant impression for Sarah's presentation. So we started her on sequential HRT, and her endometrial thickness is more than 7 millimeters. So we're going to go for this one. And that's going to guide me as to what I need to do next. So I'm going to refer her to the gynae services under an urgent suspected cancer pathway, and I'm going to provide her for information and add her to our cancer safety netting system as well. I'm just going back to here. So hopefully that gives you a bit of a showcase in terms of the formulary, the template for menopause, and the unscheduled bleeding. I'm going to hand back to Charmaine now, because the next step of all of this information from using these templates is how do you translate the care that you've given the individual into having an impact on the system and at scale, even locally or potentially across the ICB.
Thank you, Tessa. I am going to share my screen shortly, but if there are any questions that you would like to ask Tessa, then please do let us know. I think we did have a comment in the Q&A. I don't know if you can see that, Tessa, but it's just underneath my post that I put on about the initiation of testosterone. I'll let you say that word.
Yeah, no problem. So Bernadette is just flagging that we cannot initiate testosterone in Northamptonshire, and you sought advice from gynae and they said it has to be specialist only. You showed you guidance. This was just a few weeks ago, and I used to prescribe this if low libido and maxed out on HRT, which I think that sounds really sensible, Bernadette. What I would say is there is a section on our testosterone monitoring template which helps you to document that it was initiated either with a specialist advice or by a specialist, but I wouldn't say that is the case across the board, across of England. Certainly in my area we can start testosterone, and there are other areas which I've worked in where you are able to. So we haven't been able to say that testosterone is only specialist initiated. I think there's a little bit of postcode lottery going on there.
Amazing. If there are any more questions, then please feel free to answer questions. But as mentioned, we do have a women's health dashboard, which is available on our Ardens Manager platform. Now, for those of you who have not heard of Ardens Manager, hopefully some of you are using it already, but this is our cloud-based population health management tool, which allows you to be able to monitor certain primary care activities, such as women's health at GP practice level, also PCN level, and also ICB level as well. So you have that full picture of what's going on across all organisations. Now, the information that I'm going to share with you today and show you today, in order for you to be able to access this, you do have to be an Ardens Manager national subscriber. So it might be worth checking with your practice manager or anyone who's appropriate within your practice to see whether or not you do have access to it. If you do have access and you want to follow along, then please feel free to, because then at least you know where to find the dashboard today. If you don't have Ardens Manager, you can sign up for a free 1-month trial, and I will share details on how you can sign up at the end of this webinar today. So I am currently in the Ardens Manager platform. I am using a test environment, so any patients that you see today, they won't be real patient information. And you can log into Ardens Manager using your smart card. That's the recommended way we suggest you use it, because then that way you can then see patient level data. And Hannah, if you can just share the login detail for how to access Ardens Manager, that'd be really helpful. Thank you. So over on the left-hand side, how I access the dashboard for women's health is by using this services icon here. And once I click on services, I move across to conditions, and then within conditions, you've got the option for women's health. Now, it's also worth noting that when you are a national subscriber as part of Ardens Manager, you will also have access to all of this information here. So there's over 20 different dashboards available for you, from conditions to health checks to vaccinations to even contracts, so managing co-op network contract days, etc. So there's so much dashboards you can be making use of. But today's session, services, conditions, and then down to women's health. And what that will then do is it will launch the women's health dashboard. Now, I'm going to be focusing mainly on the menopause page because of the relevance of this webinar. But you'll note there that we also cover PCOS and also pregnancy, etc. So if you do want to have a look at that information and you've got the access to, you will be able to see that information. Now, before I begin showing you how it all works, it's just to let you know that information is uploaded to Ardens Manager on a daily basis. So every single day, you're going to have fresh data to be looking at, to be understanding who your population is. So these numbers will reflect real time each day, but it's also worth noting that this information is coming across from your clinical system, from SystmOne. So the information that you see here is only as good as the information that goes into your clinical system, hence why using the templates is going to be really useful going forward. Now, at the very top, it gives me a summary of how I'm doing in the organization. So I can see here that I've got 196 safety alerts. Remember, this is a training system. So I've got 196 safety alerts I need to look into. I've got a load of patients who potentially could be on my particular registers, which I'll talk to you about in a minute. And this here just tells me generally what my performance is looking like for my organization. If I'm looking at this as a commissioner, so maybe I work as a PCN or an ICB, this information will be for all of my organizations in my area if I've got the relevant sharing agreements in place. Now, as I scroll down, this is where you can see all of the different reports available for you. And they're broken down by categories. So I've got very detailed registers. This will tell me how many patients have been diagnosed with menopause or perimenopause. It will also tell me how many of those patients are on HRT. I've also got screening. So this is highlighting where patients who have not had their screening done in a certain period of time. And it's also telling me those safety alerts here. So normally it's looking at like medication where I might want to stop HRT because these patients have been diagnosed with breast cancer and we know the importance behind that. Got the case finders, and I'm going to go into these in a little bit more detail in a minute. And then you've got your performance indicators. Hopefully you're doing a lot better than what our training system is, but what will happen is it will populate with a green bar, which will let you know how well you're doing or not doing. And it will tell you how many assessments you've done, how many you've not done, etc. And again, we can look into that in a little bit more detail in a minute. So against each of these reports, you'll see a view button. Because at the very top, like at top level, it's telling me that I've got 139 patients who have menopause in my organization. And out of those 139 patients, 36 of them are on HRT. So that's great to give me top level numbers. But if I wanted to understand that population a lot better, then this is when I can use the view button. So I can click on view. And a few things it's going to tell me. So first of all, I can see that I've got 139 patients who have menopause in my organisation. But I can also see my neighbouring practices numbers as well, providing I have the relevant sharing agreements in place. So that's important to note. You won't be able to see it otherwise. Over on the right hand side, this is where I can understand my data a lot better. So I can see my trend over time on these menopause diagnosis in my organisation. I can also play around with the time frame. Maybe I'm doing a bit of research, I want to go back a bit further, then I can use these date fields here. Demographics will help me understand who those patients are. So I can see the age category. I have got 6 patients who fall, well, in their 40s who have been diagnosed with menopause. I can also see that patients in their 60s at the moment have the most diagnosis for menopause. If I scroll down, I can also see what that looks like ethnicity wise. I can see here that most of my patients who have menopause are in the under the white category, but I can also monitor my BAME population as well, should I need to do that at all. I can also look at my deprivation. So who's living in most deprived areas, who's living in least deprived areas, because that may impact the care that they receive if they're not coming in for the appointments that they need. So that gives me a good understanding of that as well. I can narrow it down further, so I can actually look at a map. So this will help me see visually where my patients are all placed who have menopause against my organisation. I can move that back and forth so I can see what my population looks like. I can also click on conditions to understand what other conditions my female patients have, as well as menopause. So I can see here that a lot of them have mental health conditions and also cardiovascular conditions as well. I can understand their risk factors. So depending on what risk tool I'm using, I can understand which of those patients are my high risk patients. Perhaps I want to target them more quicker or in a different way, and so forth. You get the idea. There's loads of different ways that you can break down that information. Now, at the moment, I've only spoken about numbers, but if I want to actually see who those patients are, I can click on my patients tab, and that will then tell me who those 139 patients are. I've got their NHS number. I can easily copy that. I can then take that into the clinical system and I can have a look at their record. Or down the bottom, I can export that information as a list. Perhaps I want to text those patients. Maybe it's the screening reports I'm looking at and I want to remind these patients they need to come in for their screening. So I can export that list if I want to. Just recently, we've introduced something called the single patient view. So against any of these patients, I can click on the view option. And that will tell me not just that this patient is on the menopause register, but it will also tell me all of the other reports that that patient's part of. Maybe they also have cough work that needs to be done. This patient also needs a vaccination that needs to be done. So if I'm putting this patient in for particular care, is there anything else I can be ticking off or doing at the same time for that patient? Filter is very good. So if I want to filter these patients in any way, then I've got the filter option here. I can click on filter and I can say, look, I'm just interested in my 6 patients who are in their 40s. And I also want to see whether or not they have a particular ethnicity, or I want to look at my high risk patients. So there's loads of different ways you can filter that list to really narrow down to the patients that you may need. So bearing all of this functionality in mind, if I then go back to the dashboard, I can then use that functionality in any of these reports. So for my screening, I may want to look at patients who have not had their breast screening done. If I click on view, that will then provide me with my patient list so that I can contact those patients in some way, understand who those patients are as well. Moving down, I've also got safety alerts. So, for instance, I mentioned stopping the HRT because they have breast cancer. But Tessa, is there anything else? And I'm putting you on the spot there. But as a GP, is there anything else in these alerts that you feel needs highlighting?
I think the particular ones like the start progesterone as has uterus, if they've got and they don't have a coil documented, and no progesterone has been prescribed, that's a particularly good one, because once you run that, then that's just catching anybody who might be missing their appropriate endometrial protection. We've also got that one which was requested by many users because they're trying to find patients who are on HRT and using GLP-1, so that's another really helpful alert. And just doing the HRT reviews as well is very useful, because you can then find anybody who's not had a general HRT review. So that, I think that's further down, Charmaine. And then you can just say, okay, right, you can identify the numbers that are outstanding their HRT reviews and assign them to somebody appropriate. So you might say, okay, the clinical pharmacist can do those and assign them to them, or I can give that to our advanced nurse practitioner. So it just gives you an idea of what the demand is for these HRT reviews and getting them done in a timely fashion.
Thank you, Tessa. Just to also mention our case finders here. So like this is querying, should the patient have a menopause diagnosis because they're age 40 and they've recently had a blood test and it's in this range and it's in this last year. So should we consider putting that menopause diagnosis on? But remember, we can refer back to the template for any further guidance if we need to. Again, I can hit view. I can see who my patients are. If I want a particular staff member to action that list, up the top right hand corner, can you see you've got this assign option? I can click assign to, and I can say who I'm assigning that to, and that will then ping them a task within Ardens Manager. So that's also worth noting, that functionality. And then the performance indicators, so Tessa mentioned these earlier. If I expand these, it will break down not just what I've done at top level, but each individual parts of what's been needs to be completed. So the referrals, the prescribing, the management, etc. If I want to just highlight patients that have not had these things done, I can click on the view option. And then I've got the option here. So you've got show achieved and remaining. I can switch that to show remaining only. And that will then just provide me with a list of patients who I generally need to follow up because they haven't had that particular care. Again, I can assign it. I can export the list. Depending on if I've got it set up in my system, I may also be able to access the clinical system from here as well. So just worth noting that too. And I think, I mean, I can talk forever for Ardens Manager, but I think that's everything.
That's good. So just bringing you back to just hopefully that's demonstrated to you that with our what we were trying to achieve is making sure that patients, our users had the ability to undertake a structured assessment, which meant that you're sort of not relying on opportunistic conversations. We can proactively identify women who need support and recall them appropriately, making sure that nobody falls through the gap. Outcomes, we're aiming to improve those because we're sharing decision making with our patients, where we've got resources to enable safe guideline-led prescribing, and we've also got the ability to follow up these patients across the women's health pathways. Lastly, our resources should help improve efficiency because documentation is clearer and more consistent, and we reduce variation. Population dashboards, which Charmaine has showed you, have the ability to replace those manual searches that you're having to do and to carry out these audits. So ultimately, we hope that our Ardens resources for menopause and HRT will improve care, not just for individual women, but across a whole population. So what you can do now, Charmaine.
Thank you. So please recommend books and training. Hopefully this has been enough for you to at least go away and consider what to use. But if you feel that training is necessary for your organization, then remember training at Ardens is free if you're a customer. So you can book training at training@ardens.org.uk. We also have Ardens Academy, which is our online learning platform. Watch out over the next few weeks where we release the start of the Women's Health Collection, mainly focusing on menopause. And if you are interested in using Ardens Manager, if you feel it's going to be helpful, you can sign up for a free 1-month trial, and that's the link that you can access there. So ardens.org.uk/trial. Remember, we are going to be sharing all of this information with you. So please, we recommend training at least once a year. So please do let us know. We do have a feedback there, so if you want to feedback on the webinar today, the content you've been shown, and also just the webinar in general, then you can complete the feedback form. It doesn't take too long.